Madam Chairman, thank you. Yes, I do. I've got a little bit of cleanup if I can. What I've been able to piece together since we started, and this is to you, Dr. Marks, and maybe Dr. Kessler. BARDA signed a contract for $1.2 billion for 300 million doses of AstraZeneca vaccine. That's currently authorized in 70 countries around the world. It's manufacturing capacity in 15 countries and 25 sites. In addition to the Baltimore Emergent Facility, 2 sites in the U.S. manufacturing in Ohio and New Mexico of AstraZeneca vaccine. So here's my question. Of the stock that we currently have on hand, which I estimate to be about 60 million doses, is all of that being held because it came from Emergent, or in that 60 million inventory that we have today, is some of that either foreign manufactured and or Ohio or New Mexico and would not have to be held up because of the current inspection concerns at Baltimore?
Senator, I have been talking to AstraZeneca even last night. I've been talking to them regularly over the last several weeks. To answer your question very specifically, the 60 million that you referenced, all that drug substance was made at Emergent. There is another facility at Catalent that manufactures drug substance, but we've not contracted and we are not involved, and that's for global. There are 2 other facilities, one in Westchester that you referenced, that is for drug product. But everything that we have involvement is in that 60 that has been produced for that first initial 100, and they stopped at 60 when because of the problems at Emergent are all being reviewed by our colleagues at FDA because of issues at Emergent.
Follow-up question: of the over 2 million doses that went to Mexico, 1.5 million doses that went to Canada, have there been any indications from those vaccines, if they have, one, I assume they have been used, is there any reason to believe that they're reporting any adverse effects?
Senator Burr, no. And those came from a time when that facility was not being used for more than one vaccine. To produce more than one vaccine, sir.
So the fact that they produce not only AZ but J&J now makes them susceptible?
It's a matter of public record that the problem that occurred at the facility involved a contamination event between 2 vaccines.
Okay.
And that was the issue that we are dealing with. But I just should add that you have our commitment that we are going to work as quickly as we possibly can to get both clearance of the doses that are currently being held, because we don't have clearance of the safety of those doses yet, and also to get that plant back up and running in a manner that's fully consistent with what Americans expect from their pharmaceutical products.
Okay, this question, I'm going to go to Dr. Fauci, Dr. Marks, and Dr. Walensky. What percentage of the employees in your institute, your center, or your agency of your employees has been vaccinated?
You know, I'm not 100% sure, Senator, but I think it's probably a little bit more than half, probably around 60%.
Dr. Marks?
I can't tell you the exact number, but it's probably in the same range. Some people vaccinated at our facility and others at outside of the facility.
Dr. Walensky?
We're encouraging our employees to get vaccinated. We've been doing town halls and education seminars. Our staff have the option to report their vaccination status, but as you understand, the federal government is not requiring it, so we do not know.
Okay, and listen, you're the face of why people should get vaccinated. And knowing and promoting and confidently giving numbers, percentages, I think is really, really important as we go into this last part. Now, if you tell me that there's some statute that says you can't require somebody to tell you, imagine being the parent of a school-age kid who for generations has been required to have their kids vaccinated before they could start school. And the fact that even within our health organizations, we can't require that of people, we're going to have tough decisions to make. Employers are going to make those decisions. There have been decisions already made by colleges around the country that said, if you're on faculty or you're a student, you're not coming next year if you're not vaccinated. Now, they have the ability to do that. These are tough questions with even tougher answers. But if we're going to get that last mile coverage, we're going to have to start portraying that we're willing to do to ourselves what we're asking the American people to do. Dr. Walensky, I think it's safe to say that the 21st century is something that CDC has not totally entered, but I'm confident that you're going to take them there, and especially as it relates to science and technology. My question is simple. Do you believe the CDC director should meet with private industry and innovators who have new technologies that can help modernize the CDC?
Thank you. I think I have an extraordinary opportunity as being director of the CDC during this period of time. I think that much of what we're going to need to do in public health is going to take collaboration with academia, with government, with private sector, with nonprofits. And I am looking forward to engaging in those in a transparent, open way so that we can have that dialogue and create those collaborations.
So let me go back and ask you one more time. Do you believe that the CDC director should meet with private industry and innovators that have new technologies?
I believe that we should I should be encouraging all of those collaborations, and I am relying on my senior leadership team, my subject matter experts, to engage in many of those conversations.
But not you?
If it's a subject matter where I'm an expert, I'd be happy to, absolutely.
I think in a question to your staff, they suggested that you couldn't. But I'll revisit that through my staff to yours. So I've got to say that I'm a little bit confused on the issue of CDC guidance after hearing my colleagues, Senator Collins and Senator Cassidy, about exactly who's involved in content and language. So I sent to CDC an oversight letter, and I got your response to it on 22 April. And I'll just highlight a few things. CDC uses its emergency response clearance protocol to clear items during emergency responses. This emergency response clearance is applicable to all CDC authored, CDC branded information products with content related to an active or ongoing response such as COVID-19 response. The clearance process consists of a series of formal reviews, approvals by relevant CDC subject matter experts, SMEs, and agency clearance officials. This typically consists of content development and review by CDC's relevant COVID-19 response task force, their SMEs, followed by additional review coordinated by CDC's Joint Information Center. At no point, given the opportunity, did the letter mention anything about people outside of government. Could be parents, it could be the National Education Association. It basically said this all happens within government. Now, that's not what I heard my colleagues say as it related to the guidance on schools, that there was input provided by outside entities. And as a matter of fact, I went ahead and pulled all the email chains that I think was accessed by the media outlets that made them write this story. And I'll just say that it's a little bit alarming because it's all done on a timeline, and it suggests that AFT leadership, not sure what the issue was they raised, but they certainly changed the language of the guidance, because there's actually email that thank them for the language that they provided. And when you look at the timeline between that and White House announcement, one would have a hard time believing that everything went through a clearance process that was described in the oversight response letter to me. So I'd ask you to clear it up for me, if you would.
Thank you. Thank you for that question. So as I mentioned to Senator Collins, prior to our putting our guidance through a formal clearance process, we do an enormous amount of stakeholder engagement to ensure that the guidance can actually address the questions asked. In fact, I can tell you on the other side, when I was a healthcare provider at Massachusetts General Hospital, I would frequently call my colleagues at the CDC and say, we need guidance on X. It needs to address X, Y, and Z. In this stakeholder engagement for the schools, we did outreach with over 50 organizations. We spoke to teachers, we spoke to parents, we spoke to superintendents, we spoke to many different stakeholders to understand what it is that they needed from our guidance. As I mentioned previously, in doing so, we recognized in meeting with the teachers that we had actually failed to comment on what happened if teachers were immunosuppressed, if teachers were undergoing chemotherapy, if they had a family member with a transplant at home, how we were going to engage and provide guidance to those. It was the CDC scientists that provided the guidance, that provided the science around what we should do. It was the request from teachers to say, you didn't address this issue, and we hadn't.
So the first contact by AFT with your staff was on February 1, Monday, February 1, and your staff person wrote, we were able to review a copy of the draft guidance, Trautner with the AFT, we were able to review draft guidance documents over the weekend. We're able to provide some initial feedback to several staff this morning about possible ways to strengthen the documents. That's on February 1 in the morning. On February 2, your staff emailed to you that they had followed up with suggested language on accommodations per exchange. And on February 3, at a White House press conference, you say schools can reopen without teachers being vaccinated. Would one reading this be concerned with this timeline and what the oversight letter told me was the protocol that you went through to have guidance signed off on?
So in the February 3rd press, first of all, in the February 3rd press conference, that was before our guidance was released. That was speaking to science and studies that demonstrated that schools had effectively reopened without teachers being vaccinated and keeping students and children safe. February 3rd predated our guidance release, which I believe was February 12th, although I'd have to confirm. You may recall at the time that in the media I took quite a hit for commenting on that from teachers themselves. They were not happy with me at the time.
And with the success of AFT, then NEA engages you, and you actually committed to do an NEA town hall meeting. Is that right?
We were engaging at the time with over 50 organizations, teachers, superintendents, parents alike, at the time when our school guidance came out, as a matter of practice and in an unbiased fashion.
Well, Madam Chairman, I'm going to ask that the letter and the emails be included as part of the record.
Without objection.
I only make this observation, that I hope you can understand why members express frustrations on guidance that there's a chain of information that suggests people had a preferred access to not only advice, but actual language that went into the guidance. I know what your answer to my last question is going to be because I've stated it in one of the emails. Should CDC guidance suggest that all states should require teachers to be vaccinated?
I would encourage all teachers to be vaccinated. We spent the month of March providing vaccines through our federal pharmacy programs, and we got over 80% of our teachers and educators vaccinated through that process. So I am certainly encouraging that all teachers be vaccinated. I think that the guidance with regard to mandatory vaccination in schools is going to have to done at the local level.
Would you provide guidance that suggested to schools that they vaccinate teachers?
We have been encouraging vaccination of teachers.
All teachers.
We have been encouraging vaccination of all teachers, of all educators, of all parents, of all students.
Is that in guidance?
I would have to confirm because I don't know whether our most recent updated guidance for schools actually had widespread availability of vaccine.
Okay. The chairman's been awfully kind to me, and I'm not trying to pick. As I said when I started, the next several months are going to be extremely tough at getting people vaccinated. I don't want any of us to lose focus on what the mission is out there. I know for all of you, I'm stating the obvious that we've got to stay focused on vaccines. But the confidence the American people have in you is a lot of what's going to make us successful. As Dr. Fauci and I have talked many times about, thank God we had in place an architecture that we perfected over the last 20 years that allowed things to happen organically, like EUAs and this type of thing. It wasn't because we experienced anything. It's we went through little red flags, H1N1, SARS, Ebola, where we looked at it and said, boy, if this had been the big one, what would we have changed? And collectively, we went through and changed them. And we were much better prepared a year ago architecturally. And 80% of what we did was following the statutes that's out there and the authorities that were given to many of your institutes or agencies, or in Dr. Mark's case, to the FDA. And I've got to tell you that I believe what the FDA has accomplished, I never dreamed they could do. My goal now is to make sure we don't roll back, because as we move into technology platforms, that's not something that is easy to go back and do clinical trials on again if you're just looking for a new indication. But I've got to tell you that I believe that schools going back in person in the fall is absolutely crucial to getting a majority of the parents who have yet to be vaccinated. And knowing that at least by the end of this month, if we're not already there, every adult that wants to be vaccinated can be vaccinated. It's time for us to start setting the stage and paint the picture for what the fall looks like. That people can go on vacation this year and they can eat in a restaurant in the Outer Banks of North Carolina, preferably. That they can plan their summer vacation, hopefully in a few more weeks or days. Maybe they can go to camp. That in the fall, we expect every school to be in person, short of some drastic change in the infection glide path. And next Thanksgiving, you ought to plan to have Thanksgiving with your family, an extended family, and Christmas you ought to be able to enjoy. If we paint that type of picture, I believe, David, we're going to get people vaccinated. But if we continue to fail at the trust that they have in us, making the calls that are appropriate at the time, feeling like they're influenced in any way, feeling like we're not out there where we need to be interpreting the science, we're going to fail. and we're going to fail for the American people, but more importantly, we're going to fail for the world, because the world right now is relying on us getting to that number and us providing the technology and the manufacturing capacity for them to be vaccinated. So we've got a big step ahead of us. I'm delighted that all four of you are here today. I thank you for the work that you've done up to this point, and more importantly, for the work you're going to do in the future. I thank the chair.
Thank you.